Hello, good afternoon. Welcome to another episode of Tribe O'Clock. I'm so happy and excited that you're here joining us today. With me today is a good friend of mine. We were in medical school together, and I'll be introducing her shortly. But before that, I will want to let you know that today we'll be talking about headache as a topic. And it's so awesome and nice having you today. Tribe O'Clock, as we all know, has a mission to help equip and then enlighten, to also encourage individuals to live the best of their lives, to thrive and to, according to God's mandate, to do well in everything that pertains to life and godliness. So you also can join in this mission. And the way you can join this mission is to share this video so that your friends and families can get to know about their health. It is very important that we take charge of our at this time. So please, you have our permission to share. The topic for today is headache. Headache. I'm sure you'll be thinking, why are we talking about headache? A lot of people talk about headache. Why is it very important to talk about headache at this time? It's been found out that headache is one reason why most people visit ER, and actually is the most important reason why people take over the counter medication. So why is this so? Why is this happening? Why is it this common? So we'll be talking about it today, and I have brought an expert to help us trash our questions and then move us forward in this. Now, before I introduce our guest, I want to ask you a question. Have you ever had an headache? It is said that about 50 to 75% of adults have had at least one headache in the past 1 year. So have you ever had an headache? So can you share your experience with us in the comments? Tell us if you've had an headache and how it feels like or what you did when you had the headache. Now, I will be introducing our guest. Our guest is Dr. Adeola Oginni. Adeola is an NHS GP, general practitioner with 17 years of experience. Ooh, that's a long time. Working with different capacities. He worked in primary healthcare and also secondary healthcare as well. She writes a column called Health Talk with Adeola for a magazine and lifestyle blog. The website will be pinned in our comment below. So please visit that website and then, get the most from Adeola's column. She also delivers health talks to different organizations. Her article was featured in a professional website on the general practitioners, and one of the articles being reproduced and adapted for use by different organizations. So you can see how much of wealth of experience Adeola has. So let us tap into that, and you also can tap into that by visiting her website as well. Adeola is married to a doctor. Actually, the doctor is her medical school sweetheart. I remember in school, they're like 5 and 6. You know what people call 5 and 6? So they actually won the best couple of the year award, of the class couple award for our class. And they are blessed with 3 wonderful kids. So Adeola, when I was reading through this, it just brought back memories. And I was thinking, Adeola must have had few bouts of headaches when we were in medical school, because because you have your sweetheart with you, and all the hormones that are produced that are helping with relieving headaches. Do you want to tell us about that, or should we move that to another time?
Well, that's very interesting, actually, and you're right. I'm dating someone in medical school. The same medical school comes with its own,
I know.
its own, hormonal fluctuations, yeah, and a few headaches as well. So you said it well, actually, yeah. Very, very nostalgic feeling as well, yeah.
Yes, yes, yes. So that's an advantage that she has by having Leye by her side in medical school. That's good. So, Diola, we are very, very excited. We are pleased to have you here. I know you're a very busy woman, giving health talks here and there. I know of, some invitations that you have in the past couple of weeks. So for you to, carve out time to be with us to discuss this important topic at this time means a lot to me, and I'm sure it means a lot to our viewer. So welcome, Adeola.
Thank you very much, Seun, and it's a pleasure to be, with you and with the guests. And I actually count it as a, privilege actually to be invited to speak on your on your kind of live show, if I may use that word. Yeah. I think thank you very much, for thinking so highly of me as well. I do appreciate that, and I hold our friendship and in high esteem. With all the fond memories of medical school, it's nice to again have an opportunity to actually have a chit chat again with you live on Facebook. And thank you. I thank the guests as well. Yeah, thanks for watching and listening in.
Yeah, thank you. So let's go straight to the topic for today. Like we said, it's our topic is headache. I remember when one of my kids when he was very young, he would come to me. I mean, he came to me one day and she said, "Mommy, my brain hurts." So I'm like, your brain hurts. I don't know if it's a brain ache or headache. So now, having said that, Diola, will you want to tell us how will you define an headache? What exactly is headache?
Okay, yeah, right. So, I mean, I think headache is, in simple terms, is pain in any region of the head, right? That is, kind of painful enough to interfere, in somebody's everyday activity, right? So that's enough to actually cause it to either sleep it away or actually complain about it, or actually call somebody's attention to it. So that's a headache. So it's in simple terms, pain in any region of the head that is enough, to catch your attention, and to disrupt everyday activity.
That's very awesome. And I'm sure most of us have had one or two of such in the past, that you will have that headache so much that you wouldn't be able to do what you're supposed to do, or you won't be able to get as much outcome out of what you're doing because you are in a way incapacitated by the headache. So now, how common is headache? Is it that common? I know a lot of people say, "Oh, I'm just having headache." They talk about it as if it's nothing. Will you say it's nothing, and how common is it?
I think you actually earlier on, Seun, you gave a very good kind of figure there when you said 50 to 75% of people have had headaches in their life, and probably even pretty more actually. And it depends on how you see it. So if you see headache as a symptom, then pretty much everybody has had it, really. Like, it will be 100%, isn't it? Because as a symptom of another illness, everybody has had headaches before in their lifetime. As a kind of, maybe trivial headache, due to all sort of reasons, stress headaches, everybody has had that. But in terms of headache as a disease entity, and perhaps use the word disorder more. Yeah, if you look at the World Health Organization classification as a disorder, then about 50 to 75% of people have had one form of headache disorder, or another, and would have it in their lifetime. Yeah. So pretty much very common, either as a symptom where everybody has had it, or as a disorder where at least 50% of people, have had a kind of headache disorder.
Thank you. I just love the way you explained that. Headache can be viewed as either as a symptom or as, a disorder. Sometimes symptoms is something that is pointing you to something to let you know that something is wrong. But by the time a diagnosis, let's put it that way, is attached to it, then we'll be looking at it as a disorder. So the headache you're having might just be a symptom of something, but if it gets to a point, it can be a disorder. Every 10 seconds, it is said that someone in the US, I checked up for US data, goes to the ER with headache. It just points out to how common it is. And this is when you're thinking about, these are the people that present. We have a lot of people that have headaches that don't present. And this is US data. So when you're talking about places like Africa, Nigeria, I'm sure we have less and less people that present. People use different things, to tackle their headache and not present at the hospital. So that can be a pointer to us to let us know how common this disorder or headache as a symptom is. So now somebody asks, I have headache every day. Is it normal?
Right. So, I think, without jumping, obviously to say an outright normal or abnormal, yeah, because it can be difficult without the full picture, but generally, it will be very unusual and near not normal, yeah, for someone to have headaches every day, and not perhaps look into why, right? Because we do all have headaches now and again for all sorts of reasons. If you're very tired, you could have headaches. If you're dehydrated, you could have headaches. So these are kind of, if I may use the word, normal headaches. So where, I'm so exhausted, I've got a headache, it will pass when you rest. So that's kind of a normal headache that we don't expect to come and seek help for. If you've not had water for maybe for hours in a day, you might have some slight headache, just to warn you. You're getting dehydrated. Again, that's normal headache in terms of, it's just a warning sign to say, go get some water, yeah? Mm-hmm. But if you have headaches every day, then we are tending towards, might not be so normal afterwards. There's probably something causing it. Now, in the cause, then we then determine, actually, is the cause something to worry about or not? So that's where we now tease normal in that sense, in terms of, for most people that will have headaches every day, the commonest reason is stress headache, tension headache, yeah? Most headaches that are sinister, yeah, can happen persistently, but if you leave it for too long, something else will happen to tell you that, hang on, this is a sinister headache. But if you have headaches every day for 6 months, for 3 months, it's more likely to be tension headache. That's what that can keep, persisting, without any other serious symptoms showing up along the way, yeah? And you wouldn't really say it's normal, isn't it? Because to be stressed on and on every day without having, distressing time, won't be normal eventually, isn't it? And so, yes, people can have headaches every day, but they need to seek out the underlying reason, the commonest of which is tension headache, among, could be other things, but that's the most common reason why people have headaches every day. And the other one is the medication overuse headache, when people actually are using pain relief for something else, painkillers for either the headache itself or other symptoms. They've got maybe pain somewhere, and that causes rebound headache. That's another one that can cause headache every day usually. So it won't be normal, really. It still needs, to be looked at.
Thank you, Adeola. You said it is actually difficult to answer that question because you need to have a full picture of that, and that just gets me thinking. A person A can say, I'm having an headache, and person B might say, I'm having an headache, and the approach to treatment will be different because headache is kind of broad. So we need to have a full picture, like you said, of the headache. There are some questions that need to be asked, and there are some, if possible, investigation, and in some cases, some tests that need to be done to be able to know exactly what type of headache we are talking about. So I'm happy you mentioned that. So if you think you're worried about the headache you're having, I think you need to visit a healthcare provider that will evaluate you and be able to, address it appropriately. So that is very good. Thank you so much for that. You mentioned a couple of times, tension headache. And can you describe tension headache? What exactly is tension headache?
All right. So tension headache is actually the commonest, headache by far, yeah. The commonest is what we call the episodic tension headache. So there are two types: there's the episodic one and the kind of chronic tension headache. So it is it's a headache that you feel like a tight band around your head. So something, kind of feeling that is a pressure, there's something actually holding your head in, yeah. Or some people actually feel it like a pressure in their forehead, so, something just there, kind of, if you wrinkle your forehead for too long, that kind of feeling that you have. And for most people, is when they're stressed, when they are tense. So that's why it's called tension headache. And it's, usually there's something going wrong, you're worried about something, or you're stressed about something or job. And for the episodic type, it comes and goes around whatever the issue is. Yeah. So it could be few days. If you're worried about something for a week, it could be there for a week. It could be a matter of 2 or 3 hours because somebody maybe is unwell, you don't know what to do, you're just tensed, or you have a problem to solve. Or in the chronic tension headache, yeah, which is the one that is perhaps commoner in women, yeah, and which they seem to think all sort of reasons might be behind it, hormonal, is it the kind of responsibility that a woman has instead of multitasking and all of that, is the one that they feel again like a tight band around the head, but they feel it comes straight from the back, like from around the neck region, and builds up around the head, and it's kind of a weight you're carrying every day. Chronic means long time, there all the time, persisting, and it kind of there all the time in the background. So it interferes softly because you're not working at your maximum, but it's not enough to stop you from doing everything you want to do. But at the same time, you will not be optimal. So that's the chronic tension headache. And it's the commonest actually amongst everybody, really, because everybody will have experienced that one time or the other, which is fine if it's episodic. But when it's chronic, then it's a problem, again, that needs to be looked at properly. And like I said, amongst other things that could be, causative factors, it's always good to seek help because, it's individualized treatment for people that have got, either tension headache, of which obviously we know the mainstay, of treatment, especially for the chronic one, is kind of distressing, really, distressing. Yeah. Even people go as far back as things like people that do yoga, do exercises, calming therapies, all sorts of things that could distress you. You don't have to really go out of the house to do something in particular. It could just be, okay, do you know I'm stressed? I don't want to watch a movie, or I just want to have a walk in open. Something that that when you do, I want to read a magazine, whatever interests you as a person can distress from kind of chronic tension headache type, but you need to recognize it for what it is, yeah, and seek help. But for some people, they actually need to seek more formal help, first to make sure that it's tension headache, because things overlap. So that's why you cannot, you have to make sure that I'm going to say before I decide this is tension headache, I need to first see my doctor, see my GP, clarify, and if it is, they would signpost you, obviously. But amongst other things, certainly therapy, relaxation therapy is a big one for chronic tension headache.
Wow, that's loaded. Thank you so much. I like the way you said, sometimes things overlap. So you might be thinking it's tension headache. You need to be sure it is tension headache before you move on with what to do. And, I'm sure one or two of us must have experienced this type of headache in the past, that you feel like a tight band around your head. So if you're having that, amidst every other thing that Adeola has said, you're most likely having tension headache. So thank you for explaining that to us. So now you mentioned something about women, experiencing tension headache more, and this gets me interested because I'm a woman as well. So will you say women are more prone, or men are more prone to having headaches?
I think for most kind of headaches, which we might be able to go into later, so migraine, tension headaches, medication overuse headaches, I think women are more prone. I think the one that is very common, that's commoner in men, is the cluster headache, and the coital headache. But apart from those two, generally women are more prone to headaches. So it's commoner in women, than men, except for those particular cluster and what's the medication overuse? Overuse. Of course, we're not talking about the sinister headaches now. We're talking about the ones that just chronic and can be dealt with.
Okay. So thanks for that. So women. Now, I know you've mentioned here and there about some types of headache. Can you just go ahead and describe, the common types of headaches to us, so that when we're experiencing this, we'll be able to know, okay, this might be this and this might be that.
Okay, right. I think I would, like we've been always been taught, like in medical school and as we practice this, in every situation, we need to make sure we take out the red flags first. Okay, we need to make sure that irrespective of whatever name of headaches we're having or whatever type of headaches we feel, we need to make sure it's not certain type. If you feel those symptoms with your headaches, whatever name you think it is, or it's been called, or you think it's been said, you need to seek urgent help, in sometimes immediate help. So if you have headaches of any sort, especially in younger people, that comes with a high fever, rash, neck stiffness, you need to call an emergency. So that's the kind of number one sinister headaches, is that That's thinking about things like meningitis, encephalitis, very, very important. Don't try to characterize that headache. Any headache that has fever, high fever, you feel really unwell, you've got a rash, you can't move your neck or your neck is stiff, then it's 999. The other one that is, again, another red flag, sinister headache, is the one we called, and what would people have described as thunderclap headache. As in, people say, again, that's perhaps commoner in men as well. People say, is the most terrible headache I've had in my life. It just felt like somebody has just hit me with maybe an iron or a metal on the back of my head. That's what we call the occiput. So the back of the head, yeah. So very severe headache that just comes suddenly from nowhere, as in you're just going or you're just fine, you've not been unwell, and you think, wow, what has hit me here? Again, that is 999, because that could be a bleed in the brain. So again, that's another red flag, yeah. So irrespective of whatever headaches you've had before, that one, you can't wait. You have to call for the ambulance. Now, and then outside that, we can kind of chill a bit and then talk about the kind of ones that, we can kind of think about it and think, okay, I need to make an appointment with my doctor. I wait for 2 days and see what I can do. I understand the pattern, and then, seek help. So we start with the, common, with the tension headache, which I've talked earlier on about, the episodic one, which happens generally everyday life, be just stressed about something, and the chronic one, which again I've described, commoner in women. Usually, again, it's a tight band around the head, or frontal headache like that, but it's both sides. And it's just there all the time, nagging. And as women, naturally, like I said, we carry a lot in terms of, we can multitask, we have a lot of things to do. This headache is niggling there, but you think, I've got to do this, I've got to feed the kids, I've got to do that. Well, I'll just carry on, and you just neglect yourself, and it just continues. Again, it's good to have a look at that, because of course, I mean, you won't be comfortable long term. You won't have an optimal life, but also because you want to be sure anyway that this is actually just tension headache and nothing else. Then we have the other one, which is, again, I'm sure very common, migraine. Migraine is that one that, really, really, really interferes with people's life here. And generally, migraine will be one-sided headache, left or right. People can tell you, oh, I have this headache on the right side or my left side. It's there all the time. It's throbbing. They use that word, that it's throbbing, like it's just there, kind of pulsating, if I may use that word, yeah? It's a bit sore in my eyes. I can't look at the light, maybe, I just feel so tired. I want to sleep it away. So that interferes a lot, that it sends most people to sleep. It's so disturbing. And for a diagnosis of a migraine, most people, migraine that is really interferes, most people have it for probably up to 15 days in a month. If it becomes that frequent, then for a migraine, you need a kind of a preventative medicine, so something to prevent, because you can imagine you don't want to have headaches for more than half of the month. It's just not compatible. So people have it shorter time, so maybe 3-4 random days in a month. Yeah. Again, migraine, left one-sided headaches, and all that, they are shy of light. So people have watery eyes. So people, feel strange on that side, which I'll talk about in a minute. But if it's a few days of the month, then you can get away with having tablets or medicine that you can use on the spot. The trick about migraines, though, is once you suspect you're going to have a migraine, that kind of one-sided headache, and I'm saying this on the assumption that now you've had this, what appears to be a migraine, you've sought medical help, it's been confirmed that it's migraine and nothing else to worry about. How do you manage it? One is avoiding triggers. If you know what triggers, some people have triggers. Some people, it sounds bizarre, but some people just think having a chocolate can trigger a migraine. Some people is, all sort of things. Yeah. If you know the trigger, avoid it, obviously. But for most people, they don't have a clue. It just comes on to them. But if it's that one that is randomly and your doctor has not said you should prevent it, then there are things over the counter in the chemist that you can get, tablets, sprays, melts that you can have from the pharmacist, and they would advise you on that. But the key is taking it at the very onset of the headaches, because once migraine kicks in fully, there's decreased absorption from the tummy of the medicine. The mechanism of migraine is such that, without going too much into medical details, once it kicks in, the absorption from the tummy is reduced. So absorption of the medicine you take. So they say early on, if you think, oh gosh, this is migraine coming on, get your tablet and have it, because you have a better chance of it working. Because when people say I took those tablets and it doesn't work, it's because they've left it too late at times and the tummy is not absorbing that medicine. Yeah. So people even get to be sick, and that time it's too late to have anything by mouth, because it's just going to come back. Yeah. But again, for the recurrent migraines, then again, your doctor would advise you, but generally we give preventative medications, and there are quite a few of them. All right. So this means you take a tablet every day to prevent it from coming all together. Because if someone has headaches 15 days of the month, that's enough to stop you from going to work or go to school or even looking after your home or, whatever you do. You really do not want to have headaches. You want to have something, again, to prevent it. And there are all sorts of medications available, mainly on prescription. They've got a few, Pizotifen on over the counter. I mean, because obviously we're talking to a worldwide audience now, so I wouldn't want to mention specific names, obviously, and also for safety, but we've got a few preventative medicines over the counter, but most are doctor prescribed, yeah? And there are things that you take every day, but they'll check other things to make sure it's safe for you. So, but migraine, I talked early on about migraine in terms of there's something you need to look out for. But people say aura, yeah. So people have a kind of a warning sign, for me, use the word, yeah. They have a feeling, they might have tingling on their face or on their hands or something to warn them or a peculiar feeling. They feel like something is coming up from the body. It's all sort of, there's no real defined aura per se, but all sort of reasons, that's a warning sign. But at times it goes beyond that, where there's what we call a weakness on a transience, so you need to separate that, obviously that's, again, it's always difficult to know, is this an extreme, is this a stroke, yeah? And that's why with migraines, especially with women, we worry about if you're on contraception, if the family history of stroke, you need to be a bit wary of any sign apart from the headaches. So things like tingling of the fingers, feeling of weakness on the side of your face, which interestingly happens in migraine, but there's always a thin line between this is actually part of my migraine, and actually this is actually something else serious going on, like a clot in a vessel. So again, at that point, if you're not sure that you've been told by your doctor that actually you have this kind of head migraines that has other symptoms that comes with it, please, if you have any weakness or any tingling or any odd feeling on the side of your body or visual loss, so you suddenly cannot see properly, or call the emergency Adeola, because again, it could be something extreme, but but hopefully not very common, but we need to be aware of that. So then we got the cluster headaches. Yeah, that's another terrible headache, because it's cluster. If I'm using that word cluster, it comes in clusters. So it could happen every day for an hour, even as less than 10 minutes, 20 minutes, but it will happen in clusters all through the day. You have bouts in a cluster, 6 clusters a day. Terrible headache, again, one-sided, but not on the forehead like migraine. It's usually at the back of the eye. The eye will be red, watery. Some people have blocked nose. Terrible clusters. 30 minutes of terrible pain. You feel better 1 hour. The next 2 hours is started again. That's a cluster headache. Usually, it's a very tricky one to treat, actually, that one. And it's commoner in men. But most people with debilitating cluster headaches will not usually need to see their doctor for a preventative medicine, because it really can be debilitating. Because, and again, most of the things you need to treat cluster headaches, apart from the simple painkillers, which we can get over the counter as well, like, even for other headaches, migraines, tension, paracetamols, ibuprofen, depending on where you are. Again, I don't want to mention the names that are not common worldwide. You need oxygen for cluster headaches, and most people, we don't have oxygen at home. So cluster headache is one headache that usually gets people to the hospital, because they need that kind of oxygen and all that to help kind of douse the effects. But generally, preventing cluster headaches is usually the mainstay, and it's usually kind of doctor prescribed for cluster headaches. We've got what we call medication overuse, which sounds counterintuitive, because if you have a headache, you would normally think, okay, I've got a headache. Normal people would just not pick up the phone and call the doctor. I've got a bit of a headache. I take a medicine, that we all have at home, the simple paracetamols or ibuprofen, things like that. But over time, and sometimes codeine, because there's codeine over the counter in some countries, in the chemist, so people can get to the chemist and buy these medicines. But over time, especially for women that have chronic tension headache, they then, because they just need to get along. They just get used. They realize that when they use these medications, they feel better anyway, for like an hour or two, they can get, so they start buying these tablets to relieve the headache. And with time, it becomes a medication overuse headache itself. So another headache so you cure the tension headache or whatever headache it was and created another one, which is very common. And in medication overuse headaches, what we normally recommend is you're going to have to stop all these medications, really, especially the painkillers, and it's commonly painkillers. And again, when you do that, again, obviously with your doctor's help and all that, usually relieves the headache, and they have to use another measure to help you overcome that. That's another, fairly very common headache, medication overuse headaches. I mustn't forget that lots of medications we use for all sort of other illnesses can cause headaches as well. So we've got blood pressure medications can cause headaches. As a side effect, I mean, yeah. So the side effects of medications that you use for all sort of reasons. So antidepressants, side effects can be headaches. So again, if you have headaches as well, it could be a side effect of something else you're using for other reasons. And you might need, obviously a healthcare professional to tease that out for you. So I think we've talked about migraines, chronic tension headaches, cluster headaches, medication overuse headache. There's another one.
Before you go on, Adeola, I would like to come in here because somebody asked a question. He said, what about headache that is around the back of the head?
Okay.
So, go ahead. Okay.
Right. So, well, that's a very, good question, I would say, and thanks for the question. So headaches on the back of the head can be, the commonest reason, like I said earlier on, is the tension, chronic tension headache. It's been thought that it actually erupts from the tension in the neck. The neck muscles over time, and it rises up into the back and it just sits there. It just stays there all the time, and you just plod along. And and I think for whatever reason, people seem to cope with that kind of the one at the back of the head and think it's fine. There's something in front of your head. You think, oh no, that's serious. I have to seek help. But it's just at the back there. Oh gosh, it's just lower down, just between my head and my neck at the back. I can get on with it. And that's what the commonest reason of that headache. But having said that, like I mentioned earlier, the one that also happens at the back of the head, which is a serious kind of headache, is the one that can cause a bleed in the head. But that usually doesn't just sit down there and nag all day long, like chronic tension. That is usually very sudden and painful. And for most people, to be fair, they seek help because it's just a terrible pain that's come from nowhere. So generally, it spurs people to seek help. So these are the two common headaches that can come from the back. But again, like I said to you, things can overlap as well, isn't it? Headache at the back of the head can start off, as a sign of another symptom of another illness coming up. When even in COVID, there's headaches all over the place. All sort of reasons can cause other. But generally, the one that's been typed for the back of the head are those two generally.
Okay, thank you for answering that. So usually when you have tension headache, you have like a band on your head. So sometimes you feel it at the back of your head. Sometimes it gets to your neck. When you're tense, sometimes you want to hold your neck like this. It's like something is pulling your neck. So that is like a pointer to the type of headache you're having. And thanks for that. You have done so well explaining a lot of different types of headache to us. I like when you mentioned that about medication overuse headache. Medication overuse headache. Yes, I'm correct. So sometimes you use a painkiller for your headache and you get headache from it. Sometimes you're using a medication for a particular form of disease or sickness or diagnosis, and you're getting headache from it. So if you have headache, so try as much as possible to check the medication you are on. Most likely, it might be, it's a very common form of headache, cause of headache, medication overuse or medication side effect. So it's very good for you to check your list of medication and be sure that your headache is not coming from that. So somebody asked a question. She said, I usually experience headache after sexual intercourse. Is it normal? Should I be worried?
Right. So headaches during or after sexual intercourse is again fairly common. Not as common as the other ones, but it's been well reported. And again, thinking about normal and abnormal, because generally there's no cause, there's no problem usually. But we do advise that until you've seen a doctor and has told you they've done the checks and I've told you, okay, there's nothing to worry about here. We just have to manage it for you. So maybe this is what you can do, I don't know, before or immediately after sex or something of that sort. You cannot assume that it's normal. But generally, it's a benign cause of headache. So benign means harmless. They seem to think it's due to kind of a little, kind of expansion of blood vessels in the brain. And why they have to check you before reassuring you is because in some and I said that with caution, very, very little number of people, they found some minute leaks in the brain in people that have got coital headache, so headaches during sex. but a very minute. But the trouble is, we don't know who is that minute. So for more, if you do have headaches during and after sex, because for some people it's during the action itself, some people it's at orgasm, they have the headaches. First and foremost is to seek help first. They will do some things, like a scan of your brain before they can reassure you. I don't think anybody can reassure you confidently to tell you, oh gosh, it's harmless before, without seeing you and doing a few things. But generally, for most people, it just happens. They can't do anything about it. They've not done anything wrong. There's nothing wrong with them. It just happens. But the caution is, until you get that information from your own doctor that's checked you out in person, then you need to first report it.
That's very good. So Adeola had explained to us that headache during or after sexual intercourse, it's not unusual. I mean, we've heard of that, but at the same time, you should try and talk with your doctor about it to ensure that it's not overlapping. I'll keep using that overlapping because I really like the way Adeola explained that. There are different causes of headache, and some might be overlapping with the other. So you want to be sure the type that you're having. So you want to be sure that it is actually coital headache and not something else that you're experiencing. And once you've been able to hash that out with your doctor, then you can know if it's just coital headache. I don't think it's harmless. It's just, all you have to do is just rest, and it relieves itself within minutes after the coitus. So thank you for that. I know we've talked so much about stress headache, and I'm going to bring another question back on it because you mentioned that tension headache is the most common cause of headache. I know there is a saying that is said, don't let anyone build an apartment in your head, something like that. And if anyone is going to build an apartment in your head, just make sure that they are good tenants, something close to that. So when you talk about stress, we as human beings, we undergo stress in our day-to-day life. Yeah. Either, stress of going to work or stress of, different things. In Africa, you have to look, different forms of stress. So what type of stress are we talking about here? Is it loss of a loved one, or is it just ordinary sex stress like I need money to pay my child's school fees? Or is it like, what type of stress can trigger headache?
I mean, interestingly, it's actually, for most people, is stress of everyday life, yeah? It's kind of, the commonest reason actually could be things related to work, work demands, work expectations, or kind of feeling, not, living up to expectation at work, or worried about losing my job, financial worries. So these are not, stresses that are out of the ordinary. They're not, they're not out of place. So they're everyday stress, and that's why it can be there every day for a long time, because these are things that you wake up to every day. You're worried about maybe a child that's unwell, for a long time. So maybe people that have got disabilities, or they've got a child that's maybe, I don't want to use, kind of a child that's a bit more challenging, if I'm gonna use that word, yeah? So something that they can carry with them every day. And that's why it's always chronic, isn't it, and persistent, because it's there all the time. You really can't walk away from the cause, because obviously if you can, walk away from the cause, then the stress will be gone and the headache will relieve. But it's something that you probably will have to live with. But what you then want to do differently is actually help yourself to cope with that stress, to prevent you from having the stress headaches. Most of the time, the underlying problems, like I said, are everyday problems that you necessarily cannot completely walk away from. The treatment, however, is actually to strengthen yourself or build yourself or discover things that help you cope with the stress that you're going through. If it's something that you can walk away from, obviously, if it's something that is kind of too impactful, then obviously you can. But for most of us, you need kind of maybe a walk. You might change your walk if you can, but obviously that's not as easy as it comes, isn't it? You can't leave a challenging child, for example, just like that. You have to then modify your response to those things that one has to actually have to bear with. It's most of them are part of life. That everyday challenges.
Thank you very much. I would like to talk about ask question about caffeine. We know that some of our over-the-counter medication or painkillers have caffeine. And then we also know that, caffeine can actually cause headaches. So what exactly should we believe? Does caffeine actually mar or make headache?
Right. So again, those are kind of things that, I think is the balance that is the key there, isn't it? So in simple terms, caffeine can cause headaches, but can also be as a part of the treatment for headaches, which is a bit counterintuitive, because you're right. Some of the over-the-counter medicines have caffeine because somehow they realize, adding a little bit, it kind of makes you more alert, helps you with the headaches, obviously takes it away with the painkillers, but overuse of caffeine, I think, and just like with everything in life, isn't it? Whatever we do, everything, I mean, even fruits that is meant to be good for us, you can actually take, diabetes, for example, if you take too many fruits, then it becomes a problem, too many sugary fruits. So just like everything else we do, moderation is the key. So caffeine in itself, in moderation, having a cup of coffee or two in a day is fine. But if you're having many cups of coffee in a day, then obviously that will cause rebound headaches. And again, even in the medication you talked about, if you're using it for a purpose, I have a headache, I just have it 1 or 2 tablets or whatever is the right dose, and you stop at that, then it's not a problem. But if you use it every day, it becomes medication overuse. The caffeine, the constant supply of caffeine then becomes enough to cause a rebound headaches. So I think moderation is the key. Is that thin line of knowing how much is good enough.
Thank you so much. And we've talked so much about different kinds of headaches, and there are a lot of type of headache. And today we've been able to talk about tension. We talked about cluster headaches. We talked about migraine, medication overuse. We talked about coitus headache. There are some other common causes of headaches. I just want to, highlight it out there. So when you're having a headache, just try and find out what's changed in your lifestyle within that time. If you have a new headache, like some people, women, we have all these braids on. when you just when you just make your hair, it's very tight. I have a friend that had these very beautiful braids, and then I saw her the following day and the braids were gone. I was like, why? She said, I was having this headache in the middle of the night. I told my husband, cut it off. So sometimes you might have a tight head wear or tight hairdo. Sometimes it's incorrect eyeglasses. It's stress, like you said, noise. If you're exposed to noise, you start having headache. Just try and get yourself out of that place. So Adeola also told us about dehydration, when you're dehydrated. And let me ask you this question, Adeola. How about hunger? Because I remember now when I was young, my mom, Dr. Mommy.
Yes.
Our mommies are our first doctors, right?
Yes,
so
absolutely.
Dr. Mommy I was having headache, and Dr. Mommy told me, go and eat. So she gave me food, go and eat, and I will check the headache after. So I ate and I forgot about the headache. So what do you have to say about that? So does it mean that food can be a medication to some kind of headaches?
I mean, nothing beats the wisdom of mothers, isn't it? Yeah. Nothing. As in, most of the things our mothers did, had medical basis. They didn't necessarily go to school to study medicine, but they learned on the job. And that is actually spot on, isn't it? Because we know what we call hypoglycemia, low blood sugar causes headaches, isn't it? It's one of the, and that kind of ties in with what I said. Headache can be a symptom. So headache is a symptom of low blood sugar. If you're hungry, you have terrible headaches, you get irritable and other things. But generally, it's a big one. Headache is a very, very well-known symptom or sign to say, hang on a sec, it could be hunger. And once you eat the food, that's it. Mommy's right after all. She is right, And again, that takes me to, if you use headache as a symptom of low blood sugar, it can be a symptom of high problem. Remember, glaucoma. So people have high, they'll have pain, terrible pain in their eyes, which is just, and glaucoma is raised pressure in the eye. In simple terms, there's a raised pressure in the globe of the eye, and that is, and urgency. It's not emergency per se, but it's urgent. So you can't wait for forever. It's not something that if you think, it's difficult to know, but if you got pain in the eye, you need to seek help. The first person will be your optician or optometrist, as the case may be, and then your doctor as well. So that's a symptom of a serious high disease. There are other things, other things we call, other very kind of bigger things like temporal arteritis, which causes tenderness on the scalp. It's a pain in the scalp that is a symptom of something serious that can cost somebody the eye. So headache is a symptom of all sorts of things, and that's why I said until we have a label, until you've been told it's a primary headache disorder, you cannot assume it is nothing. So you have to assume there's a problem until proven otherwise. Obviously, it doesn't mean you have to jump now, but it just means you need to kind of book an appointment and get it all sorted, except of course the very ones that you need 999 for. And we shouldn't forget children, should we? Headaches in children, it does happen. I mean, the commonest again in children is things like dehydration, they have a fever, so part of an illness, of an infection or something of that sort, but they also do have primary headache disorder. And interestingly, their migraines in children is usually abdominal at times. It's not the typical one that we have. They can tell you that, oh, I've got headache here. At times, most of the time in younger children, less than 12 usually, is what we call abdominal migraine. So it's a migraine, but they tell you that they can feel it in their tummy rather than their head, but they have migraine because of the way the nerves are not fully developed and the way they perceive sensations. So we as adults can completely localize the pain. Sometimes children struggle and they come close into their tummy, and they actually can feel it because of the kind of distribution, in childhood. And that has to be looked at separately as well. So children will be sick all the time. They will keep going to their doctor for recurrent abdominal pain. The doctor will check and do also. They can't find anything in the tummy. It's called abdominal, it could be abdominal migraine. So we should not forget about, children as well. And of course, generally we don't, as you know, we don't even take risk on children. If a child has headaches, it's persistent every day, 2 days, 3, 4, 5 days, you should seek help. Yeah. And generally for children headaches anyway, it's usually treated by or initiated by specialists. Somebody has to actually look at that and make sure there's nothing else going on before calling it migraine of any sort, or which is perhaps about the one that is common in children. All the other ones are not obviously common because they don't have stress, for example. So yeah.
Well, thank you for mentioning that, because one of the questions I have here is about somebody sent in a question. She said, my 10-year-old usually complain of headaches. She said, what can I do to make it stop? Well, now I think Dr. Adeola had actually explained to us, because children, it is very, very difficult to know exactly. Sometimes they don't have even the words to express it. And then sometimes their body localizes their pain in a different way from adults. So if your child, the person that sent me that question, like Dr. Adeola said, please visit your pediatrician and talk to her or him about your child's headache, so that he'll be able to let you know, we'll evaluate and let you know if it's actually a primary headache or a secondary headache, and he will be able to let you know what to do in that instance. Thank you so much. Now, going to our next question. Somebody asked, what measures should I take to prevent or reduce headache?
So, I mean, that's an age-long and question, yeah, and very nice question. Thank you. And it just would take us back to, what has been, kind of encouraged and preached, from long ago. It's the usual everyday healthy eating, exercising, avoiding triggers. If you do know the triggers, some people have triggers. At times, it's not rocket science, but I mean, it's not like it's something really big or something that anybody that stays out, and it might not sound sensible to the next person, So people have said to them that they know that maybe groundnut, for example, I'm just using an example of what people have told me in the past. And people will think, of course, I have groundnut, I'm fine. But some people would actually have groundnut and have a headache. If you know definitely that it's something that causes you too much headache, then you can avoid it. So, kind of healthy eating, exercising, avoiding the triggers, distressing. We all, I mean, none of us can deny the effect of stress in whatever we do, whatever job we do. Even people that don't even work, maybe they work at home with their children or something. Stress is everywhere. Remembering when you're having too much, when you need to take a break. It's not necessarily going on holiday or something of that. So that's not what we're talking about. We're talking about just chilling out for 30 minutes in your home, shutting everything down. I think, do you know what? I'm just going to rest. Okay, I'm going to have a walk. If you like to walk. For someone like me, I like walking if I have fresh air coming on my face and my head, I'm good. That is bliss. That's me. That's my holiday done at that moment, honestly. And it works for me once I just get the fresh air. So it's kind of discovering for yourself what works for you, and it doesn't have to be anything that is expensive or anything out of the ordinary. So distressing it, and knowing what exactly would help you chill. So that's ways to prevent it. And also your medicines, kind of be cautious of the kind of medicines you're taking all the time, even especially because lots of us, we do take medicines over the counter as well. Be mindful of, could it be impacting on, these headaches I'm having? Could it be, a trigger? Could it be a cause? So being mindful, because when generally when they ask you what medications are you on, you kind of tell your doctor or somebody the medication that are prescribed for you. We seldom remember those things that we're going to buy over the counter that we're using for maybe a fever, for example, for a whole month or in summer. We don't remember all those little things we buy ourselves. So that's very important to remember. Then the very cheap one, that doesn't cost a penny, sleep. Right. So sleep is one thing that is free. Well, I mean, for people that don't have sleep disorders, you don't, but it can impact on one's lifestyle. It can cause, obviously, if you are sleep deprived, you will go in about with chronic tension headache because your head is heavy, heavy all the time. So if you have an infection, for example, with sinusitis, for example, because that's another common cause of headaches, infection of the sinuses, blocked nose, head feeling heavy, as if you're carrying lead on the head. So these are kind of things. So if you have that, obviously that's the reason, then you treat that and then your headaches will go. Sleeping very well. Yeah, very important, because that again is something that, in fact, that's why some people when they have a headache, they go to sleep it out. They just I'm going to sleep it out and it goes. So sleep is another one. Having knowing your pattern. Some people can thrive on 9 hours, some people can have about 6 hours, but it's just knowing yourself. But generally, everybody needs sleep. You can't say I can thrive on 3 hours sleep every night. You can't thrive for about a month, but it would soon bounce back on you. Then headaches will definitely, without a doubt, headaches will set in. So I mean, those are the things that comes to mind. So for most people, it's just kind of having a kind of reasonably balanced life, which of course we all try to do, but can be difficult at times. Yeah, and I do recognize that.
That's really good. So sleep, guys. Sleep is very important. I know to some of us, it is very difficult to fall asleep and to get sleep, but make sure you get whatever help you need to be able to sleep, because sleep deprivation is one common cause of headaches as well. And then, like we've been saying, that tension headache is the most common and all that. So you need to try and reduce stress as much as you can. I don't even know how to explain that enough. Most of us are stressed about things that had not happened, and at the end of the day, find out that thing will not happen. And even if those things happen, the world will not come to an end.
No.
So just make sure to create a form of happiness around you, and you know how you can create an happiness for yourself. Like Adeola said, she finds a relief, stress-free time, walking in the park and all that. Yours might be watching movie, yours might be talking to a friend over the phone. So find out what your own happiness area is and try and dwell in it. You can significantly reduce your headache by doing those things. So rest, good diet too, reduce alcohol intake and all that will actually really, really help to reduce your headache significantly. Thank you so much for that, Adeola. So when should I be concerned? Because we've been talking about headache and we know that, we're talking about this home remedy. Sometimes you just have to eat food and you're okay. You drink water, you hydrate yourself, you're okay. You take over-the-counter medication and you're okay. So and then you also told us that sometimes you have to call, at some time you have to call 999, 911 in our own case, ambulance, whatever. So when should I be concerned about my headache? What are the signs or the symptoms that I will see that will make me say, hey, now I need to see my doctor immediately?
All right. So I think I'll start with children first, okay? Because again, very, very difficult with children, right? If your child continues to, complain of headache that is lasting 2 days. So when they come back from school, they have a headache, of course, maybe they're tired, let them sleep it off, give paracetamol, whatever you use at home as home remedies, that everybody in their country can use. And then they'll be fine. But if it's getting to the second day or the child is just listless, kind of not right, your child. Children have a very low threshold, yeah, because what with children is subjective. But that I mean is what they tell you, you're going to tell the doctor. It becomes long-winded. So if you're not sure or the child is not right, any complaint of headache from a child, seek help as soon as you can. And lots of people have other means of seeking help. So it doesn't necessarily mean physically go to the hospital. You might be calling a help. That lots of help available. Calling for advice on the phone. You also characterize the headaches for you and say, okay, hang on, this is fine, the child will be okay, or I'm gone, no, you have to go somewhere. So it's kind of, you have to know the threshold of seeking help, wherever you are. Also, without even mentioning different kind of severe headaches here, any change in character. Okay, so you've had headaches all your life, all sort of headaches, yeah, that you've been told is fine. You've actually seen the doctor, actually, they say, oh gosh, you got migraine. Oh no, you've got tension headache. Oh, you've got, all sort of all that kind of headaches, yeah.
Mm-hmm.
But and you know the pattern, yeah. You know that when it comes, I know what to do now. It comes this way, it lasts for this, and it gets worse with this, it gets better with this. You know the character. If there's a change in character, yeah, any change in character of your headaches should get you a big concern to seek help, because most of the time, once you have a label of a primary headache, you have a name, it will follow the same pattern. You can predict it. If there's a change in the pattern, in the frequency, in the intensity, right? So it's happening many times than normal. It's maybe more painful or harder, or is interfering more, affecting your eyes more. Symptoms are different from what you normally know. Weakness, of course, any headache with any weakness of any side, or persistent, tingling that is not resolving. Again, that's when you should call for help. And I actually forgot earlier on, very important one, because for most of us, when we go to the doctor to seek help for headaches, we have something in our mind. Do I have a brain tumor? That's the commonest reason why people are afraid. Actually, yes. I don't know if I got that all the while. So is that a tumor? Is there something growing in my skull? That one is usually, again, persistent headache, and it can be anywhere. That's what I say. So it can overlap. It can be back, it can be front, it can be side, it can be center. It has no, anywhere. But people realize that it's there all the time. It doesn't get better. When you wake up in the morning, it's there. Because for most of us, no matter how stressed you are, remember, once you wake up in the morning, before the day starts, you don't have headaches, you understand? It's when you get up that you usually have the headache, because then the day starts, oh, I'm this, I'm that. But generally, when you sleep, you have peace. But if you wake up in the morning every time with a headache, then you should be concerned, because again, we're worried about things growing in the brain, tumors, and that's, another reason why people get, obviously worried and all that. And it's a true concern. If you're having headaches and you're vomiting all the time, again, it's a cause for concern. Even if you had a fever, irrespective of the cause, headaches, once in the morning, on sitting upright, making you sick, having changes in your eyes, blurring of vision, pain in the eye, you should seek help. So that's always the case. And of course, the other headaches that comes with being unwell, fever, rash. I mean, we say that, historically in the literature, but we know generally that lots of, if you're dark skin, you might not even notice the redness of the skin that comes with this meningitis or stuff like that. So, but persistent high fever, right? Stiff neck, you can't touch down on your neck like that, like I just done, that kind of thing. You should seek help. Or altered sense of awareness. So if you're feeling less alert, and that's also very important in children, feeling less alert, not just quite right. You're a bit drowsy than usual. When people have end injury, for example, people that play rugby, or even when children fall off, or somebody threw a ball to your head, or you banged your head, you have concussion and you'll be fine after a few days. But in some people, then they start feeling drowsy, they start getting confused or struggling to find words out, they are sleeping more. Then again, you need to, especially after a head injury of some sort, you need to seek help. Yeah, so those are kind of things that will make you think about, hang on, this is a bit of a different one. And like I said to you, most of these serious causes of headaches that would need you to seek help urgently are usually secondary headaches. They're not the primary disorders I've talked about. They're not the migraines or tension and all that for most times, okay? Because by that time, you'll have known the nature of your headaches.
Wow, thank you so much. So we all now know, when to seek a medical doctor when you have with your headache. So if you have, some associated symptoms and it's worsening and it's not responding to over-the-counter medication, and you have to call ambulance if possible. Seek help from a medical professional. Thank you very much. Somebody said, I have had someone complain of headache, and that person died some minutes to hours after that. Can headache lead to death?
Right, I'm so sorry to hear that. That's a very, sad story, and it's really sad to hear that. But yes, it can happen, right? Again, very, very uncommon, but it's very possible. I mean, for the commonest reason is usually intracerebral bleed. Yeah, so bleeding of the blood vessels within the brain. That's usually the one that is so sudden. So there's a sudden leak. Some people, it just happens suddenly. But the underlying problems could have been things like high blood pressure that's not been treated for a long time. At times, it's nothing they've done or not done. It can be, a genetic problem, where the blood vessels are lax or weak. They are prone to bleed, and they might have tiny, tiny leaks. And that takes me back to the coital headache, where until you are dead sure that there's nothing wrong, you need to check, because they have to do a scan to make sure there's no leaky vessel in the brain, right? It could be due to obstruction of the vessels, and then suddenly it bursts. And some people actually, they have what we call aneurysms in the brain. So that kind of a big dilated. If you think of the vessels as just a little tube, and along the line a part of it balloons out. If I use that word, yeah, and you'll be there every day for 30 years, nothing, and one day suddenly it just bursts and bleeds. And some people would have headaches before then as a warning sign. But some people, unfortunately, would not even have a warning sign, which is the sad bit, isn't it? Yeah. But but if this suddenly bursts, the outcome depends on the availability of healthcare and obviously some other factors. Okay, so the quicker the person gets to hospital and they can mend things, if it's mendable, then they might not die. But if it's a very big bleed, there's a longer distance to hospital or access to healthcare. The expertise available in the region. So many other things can affect the outcome. Yeah, but generally they are very, very dangerous headaches. The likelihood of death is high if there's no intervention. And that's one of the common cases where someone will have sudden headache and then die, moments later.
Wow.
So sorry to hear.
Yeah, thank you. Thank you so much. It's really, most of the time, very painful when you hear somebody just scream, I'm having a headache, and get into the hospital, the person is gone. So sorry to hear about that, but we can prevent that from happening. And I know Adeola mentioned something about sometimes it might be some underlying disease or illness that it's left untreated. So, and that takes me back to regular checkup. We must try as much as possible to make sure we at least annually visit our medical doctor to check us up. Check our blood pressure, be sure if you need to do some tests, some examination and all that to make sure that you're in good health. Because sometimes some of these hypertension, for instance, will not give you symptoms. And the only symptoms that you might be having will be headache. And by the time you're having the headache, it might already be too late. So let's just make it a habit. Scream out time out of our busy schedule to visit our doctors annually and check ourselves up and do whatever we're supposed to do to be able to thrive in health. Thank you very much. Somebody asked if there is a cure to headache. I know as you were discussing, each type of headache, you talked about the treatment options. So, but can you, in general terms, just tell us what are the treatment options for headache? And another question I'm going to tag along with that is that the person asked that, what are your views about acupuncture? Acupuncture, what are your views? I'll just leave that to you.
Right. Okay. So the treatment options, are varied. Yeah. And I'll quickly start up by saying that, this is just for learning purpose on here, but you have to go with the advice of the person looking after you in particular, right? Yes. But generally, if you look at headaches, so these short-term episodic ones that happens now and again, is simple things over the counter, paracetamols, ibuprofen. We normally say avoid codeine because these are the ones that generally tend to cause medication overuse. So it will cause rebound headaches. Codeine would crash the headache, but if you keep taking it, it causes headache itself. So we like simple things like paracetamol and ibuprofen. Generally, if it's safe to do so, obviously, because you have to check with your other medications for that. But the ones that are actually for headaches itself. So when you have a diagnosed headache and you've been told, oh, this is migraine or other kind of headaches, they're called the triptans. That again, they're over the counter because of the way it's meant to work, because they know it's a very rapid headache that is very painful. They come in melt, they dissolve quickly at times in your mouth. So because it has to be used early on. So these are available over the counter and some are available by prescription where you use early on at the onset of the headaches. Quite a lot of them available as well over the counter. And again, the pharmacists would a very, very good resource here. You go tell them, they'll ask you a few questions and give advice to you. But if these headaches are not episodic, so they're happening all the time or for most times of the month, So, and we normally say, in theory, for classification, we say 15 days of the month and above, we start thinking about chronic type headaches, isn't it? Yeah.
Mm-hmm.
We think that interferes now. Then your doctor begins to talk about things about like beta blockers. So these are things like, propranolol and all that. Again, like I said, these medications are safe, but for example, they're not safe in asthmatics, for example. So again, it has to be judged with your other medications, but these are preventative. We call them preventative medications. Yeah. Isotifen, propranolol, they're good. Amitriptyline, amitriptyline is a very valuable resource for chronic headaches of some sort, especially when you have chronic pain from other causes as well. Very, very good medicine. It's been there for youngs, but it's always been, very helpful for people that have problematic migraines, especially, right? So we have some other for cluster headaches. The medication required to prevent are usually highly specialized treatments. So that, I will even go there, but if that has to be prescribed, not even by your GP, by a specialist. That has to be sure, and they'll obviously tell you, and obviously your GP can then begin to repeat the prescription for you. So generally, they are classified into immediate treatment, where you can just get paracetamol at home or ibuprofen, or go to the chemist for the triptans to get, or preventative, where you take every day long term, because really you don't want this headache anymore. It's happening too many times a month. Then you have to take medicine every day to prevent it from happening. Of course, they will check other things like your blood pressure, some other things that could be going on underneath to give you a tailored advice. We should not forget also the hormonal kind of reasons for headaches. So some ladies, when they're having their periods, they have headaches. So obviously, again, it's around that time, paracetamols. And if it becomes a problem all the time, people talk about contraceptives, because if you think it's going to be a problem, you have headaches when you're having period all the time, every month, then people talk about, okay, you have contraception, and that helps a bit, because some hormonal contraception helps to kind of minimize the headaches. So depending on the cost, yes, there's a treatment. I mean, I wouldn't say there's a cure, because if it's a primary headache, you can't cure it completely. And by that, I mean that if you stop taking the medication, after a while, it will come back, but you can suppress it to almost not happening. And we measure effectiveness of the medication by asking you, okay, you've been on this preventative medicine for 2 months or 3 months. How many times have you now had these headaches? So escape headaches. So if you normally have headaches 15 times a month before you start on this preventative medication, and then when you started the preventative medication, you now started having the headaches 1 or twice a month, then it's success, because that one time you can simply take simple things to kill it. But if you're having it 15 times a month before preventative medication, and then you're telling me after 3 months, I still have it 12 or 10 times, then probably not working for you. We'll try something else. So there are ways around this. You can suppress the frequency to a barest minimum to make life comfortable. So yes, there's a treatment protocol that can happen, but I wouldn't say complete cure.
Thank you very much. That is really helpful. Now, looking at what's going on around us, I mean, there's always...
Oh, you talk about acupuncture. I forgot that. Sorry.
Yes, acupuncture.
Acupuncture, yeah. So, sorry about that. I forgot. So yes, I mean, again, acupuncture has been proven that there's always been mixed what would I use? Kind of mixed reports, okay? But it's a documented and well-recognized mode of treating headaches, yeah. But specific types of headaches, okay? So where they can localize the points, the nerve points, whether on the neck, on the back, or on the head, there's specialist trained people that do this, depending on the countries you are. For example, it's alternative therapy. Some countries actually have imbibed into their mainstream, medical treatment, where a specialist would assess and feel that it might work, yeah? But I must say to you, it doesn't work for all sort of heavy headaches. Apart from that, I wouldn't suggest that if you have a headache and you have an acupuncture therapist, next door, or and just bring them up, say, can I have it for the... No, you need to first ascertain the kind of headaches your doctor has told you, and they've been advised that it might help. It's the other way around, rather than the primary mode of treatment for headaches. But yes, in simple terms, it can help in some form of headaches.
That's very good. Thank you so much. So I was going to ask about headache and COVID. So we know we can rarely talk about anything these days without talking about COVID. COVID is one disease that is going on, and it's common to every nation right now. So we know that headache is one of the symptoms of COVID. So how do I differentiate the headache from COVID from other types of COVID, from other types of headache?
Yeah, right. So I think the closest I would say to that first is if you think about flu. I don't know if anybody has had a flu before. So like a flu is a kind of, I use the word advanced cold, viral infection, kind of terrible, terrible headache. So it's just there all the time. Paracetamol would probably take it away for 1 hour or two and it will come back. It's an intense form of headache that, you've probably not had even when you've been unwell, in the past. It's just different flu. So if you then kind of go a little bit step higher with COVID. So COVID is taken as a kind of senior
flu.
Headache, yeah, just for the laugh of it. So, but now seriously though, with COVID, there'll be other symptoms, just like with flu, for example. So if you have headaches with flu, you have headaches in itself, you have a eye fever, muscle aches, you have other things, maybe a stuffy nose or running nose that preceded it, maybe a cough, feeling shiverish. With COVID as well, you have the cardinal signs of COVID, which is the cough, dry, persistent, irritating, and annoying cough that just refuses to go away, just be there, coughing all the time for most times of the day, right? You have a high fever. Usually people that have got COVID, they develop a temperature that is usually higher than 37.5, yeah? And for most people, it's probably higher than 38. It's a very, very high fever that they take paracetamol to calm it down, probably goes, for like an hour, it comes back. Loss of taste or smell. Those are very, very critical signs of having a COVID infection. The other things that goes with COVID infection, apart from the fever, cough, loss of taste and smell, 4 commonest signs or 4, kind of almost describing signs. So if you had the loss of taste and smell with a fever, for example, or with a cough, you're almost certain it's that until proven otherwise, right? But other things like muscle aches, some people have reported severe vomiting with COVID. Some people have described diarrhea. And then breathlessness is the one that makes everybody sick self with COVID, isn't it? That's the old mark of now, this is out of hand, I can't be at home anymore. So these are the kind of things that will tell you that this is COVID, right? Yeah. So it will still be kind of severe headaches like in other feverish illness, but the other signs would kind of give it away.
Thank you very much. So we know when to seek help when we're having headache from COVID. Look out for the other symptoms of COVID. And I also want to add, check to see if you've been in contact with someone with COVID. Also, if you look at the headache of, CDC find a way to define it. It said it's a development of new onset of headache, and all those kind of symptoms, headache, cough, because sometimes you might be having, flu and you're having COVID at the same time. So it's the development of new symptoms. However, we know that all these symptoms can overlap, just like Adeola had said. So you might be having a form of tension headache, before that, this is the primary headache I have, and I'm handling it. And then there might be development of another headache on top of it that might be COVID. So if you're thinking it is different from the headache you have, then it's likely different from the headache you used to have. So if sometimes our instinct has a way of telling us things. So by the time you start thinking like, oh, this headache is different, then it's likely different. So make sure you seek help. And most times, with headache of COVID, it's usually generalized all over your head with severe pressure pain. So just check yourself. And if you're thinking, oh, I was at a party last week or 2 days ago or something, then just get yourself checked up. Be sure that it is not COVID. Oh, thank you so much, Adeola. It's been an exciting 1 hour time with you. Going through our questions on headache. Thank you so much for your time. Thank you for coming to help us with this. I would want to ask you a last question anyways, like, do you have a parting word for us? Is there anything you want to give to us, like a take-home message?
Right. Right. So, well, first is thank you very much for, to the viewers and to the listeners and for people that will even be listening later on. Thank you for joining us on the program today, and thank you for those thought-provoking questions. Dr. Aluko, it's been a pleasure again coming here, and thank you for inviting me over. I would say, however, that I think generally most of our advice boils around the usual healthy living that we all aspire to do, kind of healthy eating, exercise, distressing, very, very important, finding joy, because again, anxiety can cause headaches, kind of trying to, looking after your mental health, because I don't think we talked about that as well. So kind of that is a very important cause of headaches as well, isn't it? Because it's just something that is not right. It's not physical, isn't it? It's, it's somewhere there that is, something's bothering, anxiety, depression. It will just give you a nagging headache because something is not right. So we should always remember, above all, our mental health, because if our mental health is not right, I don't even think our physical health will be right. So we should remember that we have to look after our mental health, look after our physical bodies, and hold on to, whatever faith you have. I'm a Christian, so I hold on to Jesus and God. So, there's always a higher being that you believe in, that would, help you sail through things that can otherwise, cause stress in life. And I wish you all the best.
Thank you so much. Wow, what a way to just round up that. I like it. So check your physical health, check your mental health, and hold on to the higher being that you believe in. I believe in that too. Tribal Clock is a faith-based organization. And so we believe in prayers, we believe in the higher being that you believe in. So, but while you are at that, make sure you seek medical help. Thank you so much for joining us. It's been a pleasure doing this with you and Dr. Adeola and with all our viewers today. Thank you so much. Join us next time for the next episode of Tribal Clock. I will be posting our next topic in Tribal Clock page. Please stay tuned, share this video, and invite your friends next time. Thank you. God bless.